All right, so we're going to talk about cortisol. I had someone asking about cortisol and just its effect on your weight and also how that kind of plays into our DNA cord test that a lot of you have done and some chronic disease, even things like mental things like depression and anxiety and stuff like that. So I have a really scientific, I don't want to call it present. I mean, it's a PowerPoint basically that I want to show you guys and kind of walk you through. We're not going to talk about everything that's on every slide because it's again like aimed more at medical professionals. But there are some things that I think you guys will find interesting and will take away from it. And it just kind of helps me organize my thoughts as far as going through it. So, and then I'm going to show you a real-time lab from a patient that I'm working with as far as her cortisol levels and kind of her case as far as how she's presented and things like that. If any of you jump on and have any questions during it, just put it in the chat section and I'll try to come back to that. Hold on a second. Oh, share screen. Hello. Okay. All right, so you guys should be able to see this. So we're going to talk about, let's just first kind of establish what is cortisol. So cortisol, we're not going to talk about the sex hormones today. Sex hormones are testosterone, estrogen, that sort of thing. Cortisol is a steroid hormone. So maybe you've heard that like if you take prednisone or a steroid for too long, it can mess up your adrenal system. So cortisol is a steroid hormone. It is derived from cholesterol. So cholesterol is important. I think sometimes we think of cholesterol as being something that's bad and that we need to keep down. And this is where a lot of the literature is saying, you know, having so many people on statins and having cholesterol be low is not necessarily better than it being high. We need cholesterol for things like cortisol. We won't get into the lipophilic and that sort of thing as far as transporting across membranes, but it's a steroid hormone. It's derived from cholesterol. And then I want you to, let's just briefly touch on norepinephrine and epinephrine, which are the adrenal hormones or the amine hormones, because they work hand in hand, but they both have a little bit different roles as far as like how you're going to be feeling from it. So let's talk about the stress response. I think most of you, if I asked you what is cortisol, you would say something like the stress hormone, that sort of thing. And again, I think sometimes it gets a bad rap, but remember that the human body is incredible. It is all linked together. We have very sophisticated coping mechanisms for things that our body undergoes. And cortisol plays a really important role in the stress response. So let's talk a little bit about the stress response. I do want to walk you through this graphic because it's important to understand how this is laid out. So we have the nervous system, and that is divided into the peripheral and the central nervous system. So the central is going to be the brain, the spinal cord. I always think of like everything in the center. And then peripheral is the somatic and the autonomic nervous system. And then let's focus then on the autonomic nervous system. And you guys have heard me talk a lot about sympathetic and parasympathetic nervous system. So sympathetic is fight or flight, which is what a lot of us stay in chronically. And then there's the parasympathetic rest and digest. And we've even added a third, the enteric or the intrinsic nervous system. That is all about your gut. So again, just to kind of give you glimpses, all of these are related, and we do know that the gut plays a big role in regulation, even with the other two. That's why things like the CSAP that we talked about last week are really important as far as having the good bacteria in high enough quantities, and some of the dysbiotic bacteria, getting that taken care of so that all of this works together synergistically. Let's see. So when we're talking about cortisol, we're going to focus on the autonomic and specifically the sympathetic nervous system because that is the role that it plays. So a lot of you guys have probably heard about the HPA axis. And when we talk about things like, there's a lot on social media about adrenal fatigue, and you'll hear a lot about adrenal. So this is all talking about the HPA axis, and it is the hypothalamic pituitary adrenal axis. And what it is it's our body's built-in mechanism as far as how to deal with stressors. This can come from a variety of things. It can be environmental, it can be chemical, it can be physical. It's not just like a stressful situation. So try to think beyond that a little bit. But the stress signal comes into the cerebral cortex. You don't need to worry about these two here in the middle with the CRH and the ACTH, but these are all precursors to the cortisol being released. So the stress signal comes into the brain, and eventually through the pituitary, cortisol is released. I think that this would be good for you guys just to briefly know what hormones the adrenals produce. When we talk about the adrenal glands, it's cortisol, DHEA, and DHEAS, which is really important with things like PCOS, aldosterone, and norepinephrine and epinephrine are your adrenal hormones. There's a couple of actual disease states that we always want to be aware of, Addison's disease and Cushing's disease. Addison's disease is an autoimmune disease of the adrenal gland, and it affects cortisol and aldosterone levels. And then Cushing's disease is excessive cortisol because of a tumor. But what we see most often in the functional and conventional medicine world is Cushing's, or just an imbalance of cortisol, not related to one of these disease states. And then I should mention just that the Cushing's syndrome is from a lot of cortisol, not necessarily from a tumor, regardless of the cause. A lot of times it's from like the steroid use, like prednisone, Medrol, that sort of thing. So this world is kind of called, or it all kind of falls into functional endocrinology. And it's this generalized dysfunction that is what we like. This is what I see. These are the patients that I talk to, and we'll talk a little bit about the symptoms that they come in with, and digging down into this a little bit more. But first, let's talk about stress. So I love this slide, and we're going to spend a little bit of time here for a second. So the ship is sinking, or you're running from a tiger. And this is obviously going to produce a stress response. And the definition of stress is a state in which homeostasis is threatened or perceived to be. And again, these are all different stressors, that can be coming from. So emotional, physical, psychological, environmental, and chemical. And it's important to note that this can be actual, perceived, actual stress, anticipated stress, or even imagined. So I always use the example of a meeting with your boss. Okay, so let's say that the meeting with your boss makes your heart race, makes your jaw clench, makes your mouth dry. And actual stress would be that you're in a meeting with your boss and you are having a stress response. Anticipated stress would be you're having a meeting with your boss at 1 p.m., but it's 10 a.m. and your stress response is already kicked on because you are anticipating that event. And then there are those of us who make mountains out of molehills, and we have a lot of imagined stress. So this would be like you don't have a meeting with your boss, but thinking about the possibility of having a meeting with your boss creates a stress response. And remember that stress is cumulative. So we have all these different signals coming in, and it causes this stress response, and it adds up and it takes a big toll. So where does it all start? It starts in the brain. I don't really want you guys to pay attention to this. Let's see. Let's scroll through this. I'm going to show you guys like what I want you to see in each slide. Not this. That's what the adrenal gland looks like. Okay, this is what I don't care if you don't look at the top here, but what I want you to see here is that cortisol is not stored for immediate release. So like if you are driving on the road and you almost get into an accident and you have that like heart racing, swerve, that sort of response to stress, that is norepinephrine and epinephrine and adrenal hormone response. It takes like 10 minutes for cortisol to release. So more than likely, you're still going to have that cortisol release after that event, but the initial like fight or flight, that is epinephrine and norepinephrine. Um, What's interesting about that, though, is that the more stress you have coming in, the more sensitive this whole system is. So you'll talk to people who say, you know, something stressful happened. I almost got in an accident, and it takes me hours to come down from that. So that's really something that's very common that I hear a lot. And let's see, that's what I wanted y'all to see here. Okay. Here, what I want you to see is that cortisol can bind to mineral corticoid receptors and it causes sodium and water retention. So this is where we get that really just like puffy look. You know, you'll say, my rings are tight, my socks leave an indentation at the end of the day. And it really excessive cortisol can make you just look puffy. And that's one of the biggest complaints that I hear from women that I work with is just that overall puffiness, inflamed feeling. Okay, forgive me while I scroll through this. Okay, here I want you to see that catecholamines, these epinephrine and norepinephrine, are broken down by these two genes. So if you did DNA core, we're going to look at these. And this comp gene, if there is a problem or what we call like a polymorphism with one of these genes, it really takes a long time to break down epinephrine and norepinephrine. So again, that's going to play a role too in people who have a stressor and then it takes them hours to come down. So I hope that you're seeing from some of this that we can use DNA core with these real-time labs to really put the entire picture together. And I mean, you guys know that I am always pro using conventional and a functional approach. And this is where, you know, it's really important because, you know, I would see patients in the clinic and they say that they're stressed and anxious, and we put them on an SSRI, and it's kind of like spraying Lysol on a garbage can and you never take the garbage out. We always want to dig down deeper to see, okay, well, why does it take you forever to come down from a stressor? And a lot of it can lie in some of these genetic SNPs and that sort of thing. So we're not really going to talk about this because this is just talking about the actual test. Let me scroll through this a little bit, but I want to show you. This is just all the testing. It's really in depth. And again, this is part of what we would go through together if we do this testing. Let's see. Okay. All right, so let's look at metabolized cortisol, which is like total cortisol. Some of the factors that influence this are going to be stress, blood sugar, obesity. Remember that obesity is an entire endocrine system of its own. It produces inflammatory cytokines, it produces estrogen. So when we're talking about hormone balance, inflammation, and how all of this fits together, obesity is one of the biggest things that's going to contribute to this whole cycle, and then thyroid problems. But when we're looking at cortisol levels, we always want to ask, like, why is that happening, and dig down to the root of where it's coming from and address the root of it. So if it's coming from obesity, let's really work on weight loss. If it's coming from thyroid problems, especially like autoimmune thyroid conditions, let's really work on addressing the gut so that we decrease that autoimmune risk, improve your thyroid, and then that's going to improve cortisol. Okay, so this is just a kind of, it's kind of a busy chart, and I know it's probably overwhelming if just looking at it, but if you see the highlighted line here, these are the patient values. So this is a very depressed adrenal state. There's no, we want to see a spike, and this patient has none. So this is where they talk about things like adrenal fatigue, and what some of the things that are going to cause adrenal fatigue are hypothyroidism, any sort of corticosteroids. It just really blunts your body's cortisol production. Opioid pain medications, they just slow everything down. Poor liver function. So again, this is something that I'm going to look at DNA core for, because if you have issues with detoxification, this could be an issue. And these are people who say they are exhausted. They wake up and they feel like they haven't slept at all. It's a total depletion. You know, your body like essentially runs out of gas. It produces cortisol for as long as it can, and then it's like, okay, I'm done. I have had way too much to do, and I'm just kind of quitting. These are people who often feel depressed. They have a hard time getting out of bed. They have extremely low energy. And this is something that we would look into with that. And then more commonly, what I see is an increase in cortisol. This is busy, businesswoman, busy mom. This is what we deal with a lot. So it's long-term stress. Remember that cortisol is not bad. It is designed to help us when we need it, but the problem is when it continues and becomes just this chronic long-term stress that really causes problems. Inflammation can also increase cortisol, because cortisol to a point can be anti-inflammatory. It helps reduce some of the inflammatory cytokines. So in the same way, any infection and pain can increase cortisol. And then, like I said, obesity, because obesity, that adipose tissue is an entire endocrine system of its own. If you have insulin resistance, that's going to contribute to increased cortisol. And then hyperthyroid, or if you're hypothyroid and you're taking too much medication. And then let's talk about cortisol rhythm. So what we want to see is, let me skip that for a second. I'll come back to that in just a second. Let's talk for just a second about melatonin, because cortisol is our sun, melatonin is our moon. And I just briefly want to go over this slide because I think it's important for all of you to see what melatonin does. But it helps the circadian rhythms, it helps every rhythm. It helps with timing and release of female reproductive system. So things like fertility, heavy menstrual cycles, melatonin plays a big role in that. It's one of our body's strongest antioxidants, and we often use it in cancer treatment and integrative practices because of its antioxidant effects. And we do know that low melatonin can worsen insulin resistance. And I don't know if you guys remember at the beginning of the pandemic, when one of the recommendations, if you had COVID, when those really bad strains were going around, was to take melatonin. And this is why melatonin is really helpful. Now, this doesn't mean taking melatonin over the counter. Sometimes that can be okay in a short space of time. But this really means like sleep and getting sleep and having that correct circadian rhythm is going to help all of these things. So cortisol is like your sun, melatonin is like your moon. I'm going to skip over this DHEA stuff. If you have POS and you want to talk about this more, we can talk about that. But I want to talk a little bit about the cortisol awakening response. So we want to see a rhythm of cortisol release throughout the day. So one of the things that we do differently in a functional standpoint versus like if I had a patient that I was concerned about a cortisol issue in the clinic, I would order blood work, an AM cortisol level. They would go to the lab and have it done. What we do in functional medicine is we track it throughout the day. And so I really want to look at what the rhythm is throughout the day, and the patient's able to do this through a saliva sample. You're not going to the lab multiple times. So what we want to see is this spike right here, and then it comes down in the afternoon and night, obviously, so melatonin can take over and you can sleep. So when you wake up, this is what is going to help you become alert. Inflammation is reduced, blood glucose is regulated. And we also, this number 4 here, this is basically what our body does to fight off autoimmunity. So we have cells, and when they come in, our body checks them and says, is this autoimmune? Is this autoimmune? Is this autoimmune? And if something pops autoimmune, we destroy it, get rid of it, move on. These are things that are all happening in our bodies. Obviously, we just have no idea. But if this does not follow this pattern, your risk for autoimmunity, your risk for blood glucose regulation, inflammation, and fatigue is going to go way up. So let's look at this example. This is an elevated. So CAR is the cortisol awakening response. So we look at what it does within 30 minutes of you waking up. So this patient has a normal response, but then it stays too high. Okay. So what is the patient that looks like this is going to come in and say, I wake up, I am stressed, I'm running around, the house is chaotic, I'm trying to get the kids out to school, I'm trying to get to work, I have a really high stress job, I have a lot going on, a million things going through my head, my heart's racing, I'm pounding coffee, and this is the picture we get, and how many of us can relate to that? So if you have an elevated cortisol awakening response, then again, like we want to ask the question, why? Sometimes it's going to be a little bit high if you're just a morning person, but I rarely see that be the case. Sometimes this could be an alarm goes off, like a startle response. Now, this would be more like if the alarm's going off at not your typical wake up time. So like if you have to catch a plane or something like that. If you're having anxiety or panic attacks close to waking up, depression, not SAD, is seasonal affective disorder. We're not talking about seasonal affective disorder. We're just talking about depression. Anticipatory stress for the day. Hello. Waking up from acute pain, inflamed or infection, or a stressful event happen. First things, I mean, what is the first thing we do when we wake up? We pick up our phone. Like how many stressful things could we possibly see on our phone? It's pretty high. Or if you drink caffeine or take any stimulant within 30 minutes of waking up. So, and then ovulation, everything increases at ovulation. But these are reasons why you would have an elevated cortisol awakening response. And I'm going to show you my patients in just a minute. And then a low cortisol awakening response, what are some reasons we would have that? So of course it could be that the patient didn't collect it correctly, but that's not what I want to show y'all. Excessive amounts of psychological burnout. So this is when we like really have exhausted the system and it plummets. Chronic fatigue, sleep deprivation. This can be from sleep apnea. It can be from any sort of disordered breathing. It can be from newborn baby. Chronic pain, PTSD has been shown to decrease the cortisol awakening response. Any sort of traumatic brain injury, this could be car accident, sports injury, any sort of blow to the head, because the hippocampus controls this, any sort of head injury can affect that. Fluorescent lights, and then suppressive medication. So steroids, opioids, Accutane that's used for acne, and aspirin will decrease the cortisol awakening response. And this again is someone, if you look at this trajectory here, this is someone who wakes up and doesn't feel like they slept 9 hours and don't feel like they slept at all. They have trouble getting out of bed. They're drinking 10 cups of coffee just to keep going and make it through the day, that sort of thing. So let's see. I don't think there's anything I want you guys to know from that. Okay, then that gets into the sex hormone. So now I want to stop this screen sharing and share. I hope that was helpful just to kind of take you through a little bit about what it is and how it works. And then just reiterate the importance of comprehensive testing. And I mean, the traditional medical model, it's really hard to work through all of this in a 15-minute appointment. And that's why I always say, like, medicine is great. Like, if I'm having a heart attack or a stroke, please take me to a hospital. But we have set our medical system up to try to fit chronic health conditions into these acute time frames, and it just doesn't work. All right, let me hurry because it says my meeting's ending in 10 minutes. So this is a patient that I am currently working with, and this is the comprehensive female panel that I order. So we look at sex hormones, which I'm not going to get into today. DHEAS, this is important if you have any sort of issue as far as like period, some weight related issues, and like things like PCOS, that sort of thing. But what I want to show you guys is her cortisol. So in functional labs, we're always looking for optimal, not just normal. So we see that her cortisol awakening response was really high. And I'm going to show you a graph in a minute. The good news is that it comes down throughout the day, but this is very indicative of I'm stressed when I wake up. I'm going through the to-do list. It's hectic. My heart's racing. I'm anxious. So what do we do about that? The first thing is to really work hard to turn on the parasympathetic nervous system, scale down the sympathetic nervous system. So that is, it's different for every patient. For some people, things like having quiet time, Bible reading, whatever. Again, it's different for everybody. Couple short meditations, and then also being on the right supplements, making sure that we're managing stress and inflammation throughout the day to help decrease this, especially in the morning. And then things like limiting coffee. That was a big thing that we did with her. Switching to decaf, doing more matcha, green tea instead of coffee, and definitely making sure that we wait 30 minutes after waking up before we start dumping the caffeine in. So she had a partial thyroidectomy, which probably was playing a role in some of these thyroid numbers, but just know that cortisol being too high for too long can start to affect your thyroid. So her free T3 was a little bit low. And that's why it's really important to do a full thyroid panel, and just know, like, if you go to the doctor and they say they checked your thyroid, it's always just a TSH unless you ask for more. So just push back and make sure that they're checking antibodies and free T3, free T4. Sometimes they don't because insurance won't cover it, and they're kind of like, well, what am I going to do about it if I get the result back? But okay, so let's scroll. So here's the saliva cortisol, and you can see the first two readings were really high, and then she came down throughout the day. So we are working very hard together to rebalance the sympathetic and the parasympathetic nervous system. We've done a lot of work on her gut, and continuing to work on that, managing stress. And we will repeat this in about 6 months, usually, because of the cost of this lab. And I'm happy to share an update whenever that happens, so we can hopefully see that her cortisol level is coming down. But again, we take this into account with several other tests, including DNA core, the CSAP that I mentioned last week, to put the whole picture together, because we know that these high cortisol levels are really going to take their toll on your gut. So we can't have full gut healing while these cortisol levels are so high. So we work on everything simultaneously. Like I said, it really is a web. Everything is interconnected. And I think that that's somewhere we've gotten off track a little bit, is like thinking that we can divide up body parts into all these different, rheumatology, endocrinology, cardiology, and not that we don't need those, but to have someone sit down and put the pieces together and work on it from a full body standpoint is very helpful. I mean, I can't tell you how many people are like, well, I have this, and this symptom, and I think they're related, but I'm not sure. And I go to the specialist and they say, oh, well, you need to go see this other specialist because I don't work on that part. Well, more than likely they can all be connected. I mean, You know, this is a picture of a woman who is high performing, has a lot of responsibility, and she is having trouble losing weight. This is what Ozempic appeals to, a quick, you know, let's just have you drop a ton of weight. But if we don't dig down and find the root of all of this and correct it, what's going to happen as soon as you stop Ozempic? None of the, in fact, I would argue, I don't have any studies to back me up yet, but I promise it's coming. I would argue that then Ozempic would be throwing all of this into more imbalance. So digging down and finding the root is absolutely worth your time. So, all right, let me stop sharing. I have 4 minutes and 33 seconds left. If you have any questions, for all of you who rewatch this, please let me know. And I think that is it. I'm going to stop recording.